In the world of emergency medicine, things move incredibly fast. And sometimes, one single tiny clue can be the difference between a life-saving procedure and a life-threatening mistake. Today, we're diving into a classic medical mystery, the strange case of a very dangerous mimic. Okay, let's set the scene. Picture an ER. A patient is rushed in. They're doubled over, just in absolute agony. And their abdomen is, well, it's rigid, hard as a board. Every single sign is screaming acute abdomen. Something like a ruptured appendix, which almost always means one thing: immediate surgery. The clock is ticking. But here's the twist. This is where our mystery really begins. See, all those symptoms are a perfect match for that surgical crisis, but they're also a perfect match for something else entirely, something way more unusual. And the medical team is standing at a critical fork in the road. Just look at this list: dizziness, nausea, vomiting, and diaphoresis, which is just a fancy way of saying they're sweating a lot. Now, all of these point to a serious internal problem, but they are also the classic signs of our mystery condition. You can see how this gets so confusing so fast. So, what's really going on here? The true culprit isn't a burst appendix or an inflamed stomach lining. It's venom. Yep, the source of all this pain isn't coming from inside the body. It's from an external attack by one of nature's most potent chemists. This condition actually has a name: latrodectism. It's the official medical term for the syndrome you get from the powerful neurotoxin of a black widow spider. And that venom is what's causing that unbelievable abdominal pain. So that brings us to the million-dollar question, right? If the symptoms look almost identical, how on earth does a doctor tell the difference? How do you keep from rushing a patient into a dangerous and, in this case, completely unnecessary surgery? Well, it all comes down to one critical clue. This is the key that unlocks the entire mystery. The single most important finding is abdominal rigidity without palpable tenderness. So, what does that mean in plain English? The abdomen is rock hard, but it doesn't hurt anymore when you press on it. And this lays it all out so clearly. In both cases, the abdominal wall is rigid. But with a surgical problem like appendicitis, pressing down causes excruciating pain. That's the tenderness. With a black widow bite, you get all the rigidity, but none of the tenderness. It's such a simple physical exam, but it makes all the difference in the world. That feels kind of weird though, right? An agonizing, rigid abdomen that doesn't hurt more to touch? It seems totally counterintuitive. Well, the reason for this strange finding lies in the very specific way the venom works. You see, the black widow's venom is a neurotoxin. It doesn't damage tissue directly. Instead, it targets the nervous system. Think of it like it's hijacking the body's wiring, sending the signals into total overdrive, and forcing the muscles to contract powerfully and uncontrollably. This chart just brilliantly shows the two different paths to pain. On one side, you have the neurotoxin attacking the nerves. The result is a massive, intense muscle spasm. Your abs are just clamping down with incredible force. On the other side, an acute abdomen involves inflammation, swollen, irritated tissue that hurts like crazy when you press on it. Two totally different causes for that same rigid symptom. So the crucial takeaway is this: the agony from a black widow bite is basically one giant, non-stop muscle cramp from hell. The pain is coming from the muscle spasm itself, not from inflamed organs inside. And that's why there's no tenderness when you touch it. Okay, so this is all really interesting, but why does it matter in the real world? Well, let's see how this plays out in the field. For first responders and paramedics, knowing this one distinction can change absolutely everything. This knowledge translates into a clear checklist for EMS teams. They start with the big one: check for that board-like abdomen without tenderness. Then they look for other clues of a neurotoxin, severe muscle cramps in other parts of the body, high blood pressure, that profuse sweating. And critically, they can ask if the pain started in an arm or a leg and spread out from there, which could help them find the bite site. And the impact of getting this right from the start, it's huge. We're talking about avoiding major, risky surgeries that the patient doesn't even need. And instead, they can get the correct treatment, like anti-venom and pain management, so much faster, which brings immediate relief. It's a real game changer. All right, so let's just quickly recap the main points. First, black widow venom can create a perfect copy of a surgical emergency. It's a masterful mimic. Second, the key to seeing through the illusion is a rigid abdomen that isn't tender. Third, this bizarre symptom is all thanks to a neurotoxin causing muscle spasms, not tissue inflammation. And finally, and most importantly, recognizing this difference saves patients from going under the knife for no reason. It really makes you wonder, doesn't it? What other dangerous medical mimics are out there, hiding in plain sight, just waiting for a sharp clinician to spot that one subtle clue that changes everything?